So a lot of people will ask me, what about the knee? What can we do for the knee, and who are you mainly treating? And so the answer is basically everybody. Obviously, there's a large population of that's aging, and they get that wear and tear on the knee or that arthritis. But we also have a lot of young patients. People will have sports injuries, some meniscal damage, or cartilage damage, and they'll come in. They may be in their 20s or their 40s. What I would tell you is, a lot of times when you're younger and you get a small tear or moderate tear, sometimes stem cells are actually a viable solution to help repair that. There's actually some good data to support that. So what I tell them is, if you're looking at different treatment options, you should consider regenerative medicine to see, does that skilled physician who's doing this feel that this or your specific issue would benefit from this. Some things, hopefully we can avoid surgery on, and the cells can repair the damage. But to be honest, sometimes the damage is too great, or the type or nature of the damage is not something that would repair with stem cells alone, and at least then you know. And so what I would encourage you to do, if there's a question and you're considering that, regardless of your age, give us a call. And I'll be honest though, sometimes you know, and we'll shoot you straight. We'll look at your MRI, figure out what's going on in that knee, because usually in a young person that's got a tear in their knee or something, and by young, that's a relative term, a 20-year-old, 30-year-old, 40-year-old, what have you, when you're worried about a tear, usually at that point you got an MRI. So we can look at that and try to help navigate it and say, do you need to go get an arthroscopy, or would this be an alternative to an arthroscopy? But furthermore, we have had a lot of patients that have already had arthroscopies that came back, and turns out they still have pain. It didn't resolve their issue. So I do a lot of consults on those patients, and yes, we have absolutely helped those patients. The ones that we screened and felt that we could help, that is, you know. And one thing I will say is, this isn't a slam dunk. Statistically speaking, for the patients we screen, the odds are in your favor, but there's no guarantee. We do the best we can, and that's the goal. So it's just look at it as another tool, excuse me, another treatment option. And I would argue a lot safer than most that we do in medicine, because most of the things we do in medicine have side effects and risks to them. And sometimes the damage is done and you can't undo it. It's one of the things I love about regenerative medicine. Usually if it works well. And for that small population that will say they couldn't notice a big difference, it didn't make anything worse. There's not many times in medicine I get to say that. Thank you.